I spend my days and many of my nights taking care of high-risk patients who rely heavily on government assistance to receive care to survive their pregnancies. I'm often told in real life and online, where I educate about obstetrics and gynecology, that I as a doctor should not be political. But healthcare is political, and our current government shutdown reflects just how vital a functioning healthcare system is to our country. If healthcare insurance subsidies aren't renewed, families could see their insurance double or even triple next year. And for many of my patients, many who are mothers who already struggle to make ends meet, that means making the choice. Do they pay for health insurance, or do they pay for food and rent? And when my patients have to make that decision, which they already do daily, I see the fallout every single day. My non-pregnant patients are unable to see their primary care physicians prior to their pregnancies, which means they enter pregnancy as a high-risk pregnancy because they couldn't get their diabetes and hypertension controlled prior to becoming pregnant. I see women skipping prenatal visits because they can no longer afford the gas to come to my clinic, and I see mothers delaying care until their third trimester because they've lost their health insurance. I see patients rationing their insulin, skipping blood pressure checks, or showing up in labor with no records, no labs, no care, and no idea how dangerous that their situation could be. Because in my world, those delays are deadly. When a woman can't afford care, preeclampsia goes undiagnosed. I, as an OBGYN, have seen what an eclamptic seizure and subsequent stroke can do to the brain. Gestational diabetes goes unmanaged, and I, as an OBGYN, have to be that person who manages a shoulder dystocia for a 10.5-pound baby whose mother wasn't able to afford her insulin. And a baby who could have been saved isn't there when I put the Doppler on her abdomen. I've had to be the doctor who had to deliver a baby who should have been born alive, but was born still. These are the continued and worsening realities of my future if my patients can't afford health care. I practice in both a high-volume urban hospital serving a high Medicaid population and in a small rural hospital. I see how the lack of care in both of these areas affect outcomes for my patients, and it's only going to worsen if healthcare premiums continue to skyrocket and rural hospitals shut down. We're not just fighting for better outcomes for our patients, we're fighting to keep our doors open. When premiums rise and patients lose insurance, our labor units fill with patients who are sicker and who don't have insurance, and that financial strain is unbearable. Once a maternity ward closes, it almost never reopens. So yes, this shutdown is political, and so is healthcare, but the consequences of the lack of healthcare are deeply personal. Every mother deserves to walk into a delivery room without fear of losing everything, her home, her health insurance coverage, or her life, just because she dared to have a baby in America. We need to extend the subsidies that make care affordable. We need to protect maternal health programs to keep our patients alive, because when we fail our mothers, we fail our families. I became an OBGYN to deliver healthy babies. I never imagined I'd have to stand here pleading for my patients' ability to afford the care that keeps them alive.